Thank you, sir. Uh, I am here. I am here going to discuss on the Doppler fluorometry study to evaluate the flap vascularity and the wound healing with the use of this novel tissue expander. Now, the aim of the presentation is to evaluate the blood flow dynamics used in the tissue flaps using the Doppler fluorometry study, which is a non-invasive technique. Here we investigate the Doppler fluorometry measurements after tissue expansion utilizing a novel silicone catheter balloon and propose a standardized treating clinical protocols. And the goal of our study is to offer the evidence-based guidelines for clinical integration of the Doppler fluorometry in the patients in the future use. Now, previously, a study by Coadio et al. Showed the use of laser Doppler fluorometry, but it showed concern about the use of the probe, the use of the splint, and the duration of the measurement, and also depends upon the skill of the practitioner. Sarah et al. Showed that the tissue stretch not only promotes upregulation activation, but enhances underlying angiogenic mechanisms that are responsive or unresponsive. Now, vascular growth-related blood flow is detected by the laser Doppler fluorometry, but this study is very expensive. Another study by Sankha et al. Showed that a physical examination combined with acoustic Doppler sonography remains the cornerstone of post-operative flap monitoring. Now, Yano et al. Showed that the colored Doppler sonometry is a simple, extremely useful and a reliable method for assessing the vascular status. And another study by Tabelli et al. Showed that the Doppler method helps to correlate the course of the wound healing events and help in studying the wound repair dynamics and the tissue perfusion. Now, in our study, which is a hospital-based prospective observational study, in which the expansion was used in 10 patients, for the 6 patients in the zygomatico-temporal area, and for 4 patients in the infraorbital areas. For the 3 days, the expansion using a 10 to 14 French urinary catheter was used, and after 3 days, the catheter was removed. And by the Doppler fluorometry, we evaluated the peak systolic velocity, the end diastolic velocity, and the different indices. We included all the malignant tumors, including the upper or the lower lid, any lead having a congenital malformation requiring a reconstructive surgery, and in cases of scar revision surgery due to catastrophic injuries. But we excluded any malignancy that has a lymph node involvement, disseminated metastasis, or an infiltration in the cornea. The first, there was a technique validation was used using the 10-0 Foley's catheter, and the precise measurement was taken. And for that, the protocol that we set was the first. On the day 1, there was a baseline Doppler fluorometry parameters was evaluated before insertion of the 10-0 Foley's urinary catheter, and the established for blood flow velocity, the blood flow volume, and the resistance indices. Here we can see that initially before placing there is very low amount of blood flow, and on the red dot, and the total number of blood vessels is very few. And then the tissue was inserted, and with controlled expansion over 3 days, the 10-0 Foley's catheter was placed in the area proposed by the incision and the ellipsoidal zone. And after 3 days, the balloon was deflated, it was removed, and again repeat Doppler fluorometry measurements were taken, and the data was compared with the baseline measurements. And here you can see that after the tissue expander release, the number of blood vessels also increased, the blood flow increased, and the blood flow velocity is also increased. Here you can see the live demonstrations before the expansion and after the deflation of the balloon. Here you can see there is hardly any blood vessels, and the blood flow is very much minimal. But after the removal of the 10-0 Foley's catheter after 3 days, here you can see the recruitment of the blood vessels has increased tremendously, and the blood flow velocity is also increased. Here is another patient where we can also see the pre-insertion of the blood Foley's catheter and post deflation of the balloon catheter. And here you can also see that the number of blood vessels has tremendously increased, which was not present before the insertion of the Foley's catheter. So the parameters that we explored were the peak systolic velocity, the end diastolic velocity, and the number of vessels. And here you can see that the peak systolic velocity increased from 6.98 to 10.90 centimeter per second. The end diastolic velocity also increased from 2.36 to 3.68 centimeter per second. The number of recruitment of blood vessels have severely increased from 2.30 to 6.30 per centimeter of area. The resistive indexes were reduced from 1.28 to 1.17, and the resistive index also reduced from 0.66 to 0.64. The vessel diameter of the vessels present also increased from 0.06 to 0.10, and the blood flow indices also increased from 0.14 to 0.04. So the Doppler from the other traditional methods that were explored previously has a more quantitative, predictive, and the advantageous data, and the previous data were mainly dependent on the clinical examination. And the outcomes of the balloon catheter were also surgically correlated. There were increased amount of blood flap survival. The complications rates severely decreased from the other conventional methods, and the wound healing has been improved over a period of 3 days, which required many weeks in the previous studies. So the benefits of the Doppler evaluation has is present in all the 3 stages. That is the pre-expansion stage, the during the expansion stage, and the post-deflation stage. And the benefits are helpful in both the tissue recruitment, the increased vascularity, more in faster healing, and shorter incision is required. So we improved the guidelines for a future use in our studies. So we can integrate this Doppler fluorometry in each of our patients for a clinical evaluation, and we are going to integrate these our studies for a standardized treatment protocols. And in future, if there is also development in a Doppler fluorometry, we are also going to incorporate that indices in our study. But we know that this whole of the study needs a long-term follow-up, which is lacking, and we have to integrate other additional parameters that are also present in the Doppler fluorometry. So the key takeaways are there is more faster healing, there is increased outcome of the flap vascularity has shown faster healing, and the number of vascularity increased. As a result, the patient can go home early, which is required 2 weeks to 6 weeks in the previous all the studies. Thank you.
Excellent speech.